On behalf of the Ministry of Health and Welfare, Government of India, let me first of all convey my heartiest felicitations and congratulations to the organizers of the second Non-Communicable Diseases Summit being organized in New Delhi. We are all aware that non-communicable diseases, they constitute a very large spectrum of the overall disease scenario of the whole country, and within this spectrum we have diseases like diabetes, hypertension, coronary artery disease, heart diseases, cancers, which to a large extent are preventable. We can certainly control these diseases if we know the preventive strategies. We can control these diseases if we diagnose them early. And when I talk of diabetes, we know that there are already 60 million patients of diabetes in India. It is not really estimated how many of them may be still undiagnosed or may not be receiving the proper treatment. And as per estimates, people say that within the next 15 years, this number can go up to 100 millions. And I think this makes it a huge emergency for everyone to be attracted towards this great issue of human health. I have always believed that health has to be developed as a social movement, and within health we have to ensure that preventive health and positive health, which almost are 80% of the health spectrum, they occupy a major space in our policy formulations. If we can change lifestyle, if we can teach every individual in the country how to keep yourself healthy, how to keep yourself away from diseases, and when we talk of diabetes, we know that a little bit of change in lifestyle, a little bit of control in diet, physical exercises, yoga, and if there is a need, a little bit of medication can keep you under absolute control. Diabetes is a disease which if you do not control, it spoils virtually everything. It can spoil your kidneys, it can spoil your vision, it can spoil your heart, it can spoil your blood vessels, it can virtually lead to degeneration of every organ of the body. And when you start developing diabetes, you start growing old, your productivity goes down, and I think that is a huge loss to the whole country. So, it is the right time when through this conference everybody in the society, whether he or she is a doctor or a paramedic or a voluntary organization or somebody in the government sector or somebody in the non-government sector, whether it is a department of health or whether it is any other department which can have a positive or an adverse impact on health, everybody has to rise to the occasion and contribute something positive for ensuring that we are able to deliver the goal of health for all to every countryman. We can improve our healthcare delivery system with the involvement of all, and for diabetes and heart diseases and hypertension, I am sure that if we can teach everyone in this country that they must walk a little bit, they must perform yoga, they must do some sort of meditation, they must eat little food, good quality food, balanced diet, nutritious diet, keep themselves away from things like tobacco, alcohol, etc., etc. They can probably keep themselves away from these non-communicable diseases, particularly diabetes. So, let us resolve today to number one, keep ourselves healthy and teach others to remain healthy and ensure that we are able to deliver positive health education to everyone in this society, so that we can fight with the menace of diseases like diabetes more effectively. Thank you.